Some patients develop, as they age, this hump on their back, as some people might refer to it. Really, the technical term is kyphosis, so it's a fancy word, but basically it means that the spine is falling forward like this. And oftentimes that's due to one of two things. One would be that the discs are starting to degenerate. The discs are the shock absorbers in between the bones. And as you age, they dry out and they collapse down. And as they progressively collapse down, the spine starts to collapse like this and fall forward. So it could be due to the degenerative discs in somebody, but it could also be due to compression fractures, where the bone's actually compressing down. So if you have a few bones in your back slowly compressing down, you'll also get that effect where you collapse down. If your back problem is due to degenerative disc disease, which was the first reason I discussed, sometimes there's procedures we can do to replace that height in the disc or remove the disc. And if your problem is compression fracture, especially if it's an acute or new compression fracture, there are either bracing to help with that, or a procedure that's minimally invasive, takes about 15 minutes, where we actually put cement in the bone to help lift it up and support it so it doesn't continue to collapse down. And that procedure, as I mentioned, takes 15 minutes, and patients go home within an hour of the procedure.